Welcome to Week 7. This week's topic is on diabetes. Diabetes occurs when blood sugar levels in the body consistently stay above normal. Diabetes is a disease brought on by the body's inability to make insulin, which is type 1 diabetes, or by the body's inability to respond to the effects of the insulin that it does produce, which is type 2 diabetes. Insulin is one of the main hormones that regulates the blood sugar level and allows the body to use sugar, called glucose, for energy. A 2015 study showed that more than 30 million people in the U.S. alone suffer from diabetes. Approximately 5% of this population have type 1 diabetes, with the remaining 95% having type 2. Let's start with the fact that in the United States, 80 million people over the age of 20 have blood sugar levels that are higher than normal, but not high enough to be classified as diabetes. This is known as prediabetes or impaired glucose tolerance. And while people with prediabetes usually have no symptoms, complications normally associated with diabetes, such as heart disease, can begin to develop even when a person only has prediabetes. There are several types of diabetes. Type 1 diabetes occurs because the insulin-producing cells in the pancreas, called beta cells, are destroyed by the immune system. People with type 1 diabetes produce no insulin, and must use insulin injections to control their blood sugar. Type 1 diabetes occurs most commonly in people under the age of 20, but may occur at any age. With type 2 diabetes, the body continues to produce insulin, although the insulin production in the body may significantly decrease over time. The pancreas produces either not enough insulin, or the body is unable to recognize insulin and use it properly. When there isn't enough insulin, or the insulin isn't being used as it should be, glucose can't get into the body's cells and be used as energy. This glucose builds up in the blood, which causes problems with your health. There is also gestational diabetes that occurs during a woman's pregnancy. Hormone changes during pregnancy can affect insulin's ability to work properly. This condition occurs in about 4% of all pregnancies, but usually blood sugar levels return to normal within 6 weeks of childbirth. The symptoms of type 1 diabetes often occur suddenly and can be severe. They include increased thirst, increased hunger, especially after eating, dry mouth, frequent urination, unplanned weight loss even though you're eating and feeling hungry, feeling fatigued, weak, and tired, and having blurred vision. The symptoms of type 2 diabetes may be the same as type 1, but most often there are no symptoms or there's a very gradual development of the symptoms above. Other symptoms may include slow healing sores or cuts, itching of the skin, yeast infections, recent weight gain, numbness or tingling in the hands or feet, impotence or erectile dysfunction. Having abnormally high blood sugar is called hyperglycemia, and it is the hallmark of diabetes, and it can affect people with both type 1 and type 2 diabetes. With diabetes, blood glucose levels rise either because there is an insufficient amount of insulin in the body, or because the body cannot properly utilize the insulin that is being produced. There are two main kinds of hyperglycemia. Fasting hyperglycemia is when blood sugar is higher than 130 after not eating or drinking anything for at least 8 hours. There is also after-meal hypoglycemia, in which blood sugar is higher than 180 2 hours after you've eaten something. People without diabetes rarely have blood sugar levels over 140 after a meal. Having consistently high blood sugar levels can lead to damage to organs and tissues, impair the immune response, and cause poor healing of cuts and wounds. It can also lead to nerve damage, blindness, damage to blood vessels, and kidney disease. Diabetes cannot be cured, which is why it is critical that if you're at risk, that you take the proper steps to prevent the onset of diabetes now. Some of the risk factors to developing diabetes are obesity or being overweight. This is the #1 reason for type 2 diabetes, and because of the rise in obesity among children, diabetes is now affecting more teenagers. Impaired glucose tolerance. Prediabetes is a milder form of diabetes. It can be diagnosed with a simple blood test. If you have impaired glucose tolerance, there's a strong chance that you'll get type 2 diabetes. Insulin resistance. Type 2 diabetes often starts with cells that are resistant to insulin. This means that your pancreas has to work extra hard to make enough insulin to meet your body's needs. Ethnic background. Diabetes happens more with Hispanics, African Americans, Native Americans, Asians, Pacific Islanders, and Alaskan Natives. Gestational diabetes. If you had diabetes while you were pregnant, your chances of getting type 2 diabetes later in life are much greater. Sedimentary lifestyle. If you exercise less than 3 times a week, you're at risk. Family history. If you've had a parent or sibling with diabetes, there's a good chance you may acquire it. If you have diabetes, these should be some of your goals. Keep your blood sugar level as close to goal as possible by balancing food intake with diabetes medication and physical activity. Maintain your blood cholesterol and triglyceride levels as near to their normal range as possible. Control your blood pressure. Your goal should be to keep your blood pressure below 130/80. Remember, no one can eat for you, no one can exercise for you, no one can learn for you. Diabetes self-management is all about you taking control of the disease. So if you have diabetes or even pre-diabetes, do the following. Plan what you eat and follow a balanced meal plan. Exercise regularly. Take medication, if prescribed, and closely follow the guidelines for how and when to take it. Monitor your blood glucose and blood pressure levels at home on a regular basis. And get lab tests when needed and on schedule.